talk about autologous exosome. And here we are. So I said we'll talk about autologous exosome, and this whole world today is fixated on this new topic called exosome. It's not new actually, it was there before human existed. It was prehistoric. It was there in the teeth, in the plants, in the bacteria, but now we found something new to do with it. So, what exactly is an exosome? And you get a lot of exosomes, everybody is selling exosomes, 100 billion exosomes, 10 billion exosomes, 10 million exosomes. You know, this is a lot of confusion being created. Somebody comes to me and tells me, doctor, I have this exosome, it is so many billion. How do I use it? What is this exosome? And what is it going to do? Some are using for autologous, for the knee. Some are using for the hair. Some are using for the skin. Some are using for autoimmune disease. So exactly what is exosome? So exosomes basically are extracellular vessels that are, carrying certain information. And these exosomes are cell signaling agents. So generally, this is the place where I stay in Mumbai. So those of you who have visited are more than welcome. And from the flight you can see, this is our lab where I work, and we prepare a lot of herbal and nutraceutical products over here. Yeah, so this basically are exosomes. So it looks like this cartoon picture looks very nice. Now, exactly how exosomes work, I'll tell you in short, because we need actually 8 hours to do an exosome training. And we are going to do an exosome training. So if you are interested, you can just, give your name to Dr. Janira, who's sitting here, and we'll do it along with this society, Dr. Kamal Society, this Saram Society. So together, we will have a proper training of 8 hours or 10 hours on exosome with the practicals and everything. And so when you eat food, what happens? We don't eat it. Our gut, there are millions of bacteria. They eat that food, what we eat. Then they secrete something out, correct? And that goes into our body. But when you eat drug, like a paracetamol or any other drug, we can test it in the blood. Why? Because the bacteria don't eat it. But when you eat a particular food or a nutraceutical, you can't test it in the blood because the bacteria eat it. And when the bacteria eat it, the bacteria process it, and then it comes out. It comes out as exosomes, or it comes out as micro vesicles. Inside the cell, there is something called the lysosome, that is to break open. So the lysosome breaks open all these nutraceuticals and extracts what needed to be extracted, and that extract is secreted in the form of exosome. And this exosome actually is what you inject in your body. So this exosome is the cell signal. Now when your body is under stress, what happens? 2 things happen. First, the inflammatory response happens, and then the anti-inflammatory response happens. So whatever we test, HSCRP, CRP, homocysteine, normally they are not supposed to be present in our body, right? But when you have a particular heart disease or something, then why the HSCRP rises? Why the homocysteine rises? Because that is showing that particular organ is under stress, and that protein is being synthesized and that is released in the blood. Now, when it is under stress, definitely there will be some anti-inflammatory product also being released. Some anti-inflammatory chemical being released to bring that down, correct? Or what do you give at that time? Then you tell them, okay, your HSCRP is high, you tell them you start curcumin, you start fish oil, you start omega, you do exercise. So that is all a process of naturally releasing these exosomes. But unfortunately, we are not living an ideal life. So just by this case, we may need a boost in the body. Now, to get the boost, we decided to take out these exosomes, prepare them in the test tube, and then re-inject them back into the body. It's like if I want to turn on the air conditioner in this room, it needs a lot of electricity, right? So I turn it on, the electricity goes in, the air conditioner goes on. Another way is I take a remote control and I press it, and then the air conditioner turns on. So what am I doing with the remote control? Only passing the signal. So the signal is a very micro nano current that passes through. It's just like a radio wave, just like a signal. And you can turn on such a big instrument. So same way, the exosome is just like a signal in your body. We signal your body to start repairing itself for cancer. We signal your body to start repairing itself for autoimmune disease. We signal your body to start repairing itself from, a blood clot. And that's how your body starts to repair itself. So the cell signaling is important. Now you have two types of TVs. One is a Samsung TV and one is a Sony TV. So you will obviously have two types of remotes, right? A Samsung remote and a Sony remote. So when you take the Sony remote, you put it on. Which TV will come on? The Sony TV. Suppose I take 100 or 1000 Sony remotes and I press them. Will I be able to turn on the Samsung TV? No, because the signal won't pass through. That exactly is what exosome is. You have to have the right signal. And how to develop this right signal? To develop this right signal is conditioning of the body. So whatever we are doing in exosome, your body is preparing its own exosome. The nutraceuticals that you are taking is helping the body to prepare its own exosome. Like for example, if you give silica. Now what silica does in the body? Silica gets oxidized, okay, first when it goes into your body. And that releases an oxygen molecule. And that molecule starts to release H2O2 or hydrogen peroxide and starts to clean up. Second, this silica also helps in building, it helps in building the broken tissues and all that along with calcium. So again, that's the biochemistry. That whole thing we will talk over 8 hours when we do the exosome training. Exactly for every condition, how to precondition your body. Only then your exosome will work. Otherwise, you take 10 kits, you take 100 kits. You keep on injecting, nothing will work if the body is not preconditioned. So you have exosomes, microvessels and apoptotic bodies. Somebody asked me, what is exosome and PRP? How is it different? Is it the same thing which is a new gimmick? The same type of kit with a new gimmick, with a new name, and you're calling it exosome, you're taking the blood and you're centrifuging and whatever you're doing. I'll tell you, it is not. Why it is not? Not because I am saying. You can test it in the lab. You take the PRP and you send it to the lab. You should get a lot of platelets. The platelets should be concentrated. When you take the exosome and send it to the lab, any lab that can do a complete blood count, any pathological lab, you will see in the exosome there are no platelets. Platelet count will be 0. Only if the platelet count is 0, that means the exosomes are present. Otherwise, you are giving just PRP. It doesn't make sense. So I will tell you how this works. There is a kit that is developed to separate the platelets separately. Okay. Now, when you have cancer cells, or when you have cancer cells, a lot of people are talking about what is exosome and stem cell therapy. Right? This is also a question people ask. Okay, exosome, is it stem cell therapy or is it some other therapy? Now I say exosome is different. It is not stem cell therapy. Exosome therapy is basically cell signaling. Stem cell therapy is your transplanting a stem cell into the body. It can form any cell, in your body, including sometimes, if not treated properly, it can also form a cancer cell. So when you are doing a stem cell therapy, it is important that you actually understand what stem cells you are giving, why you are giving these stem cells, and how these stem cells are going to act in your body. But when you are giving exosome, preconditioning is the word. If you don't precondition the body, exosome therapy will not work. It's a waste of your time, waste of your money, waste of the patient's money, and it will give a bad name to the exosome therapy. Because exosomes are of two types, inflammatory exosomes and anti-inflammatory exosomes. Correct? The inflammatory exosomes are generally big size. Okay, they are more than 200 nanometers, 500 nanometers. Those are inflammatory exosomes. The anti-inflammatory exosomes are very small size. They are from 10 nanometers to 130 nanometers. So, we have a kit that actually separates the inflammatory part and the anti-inflammatory part. Now, when you inject, you need to inject only the anti-inflammatory part to get a good effect in the body. Correct? You don't want more inflammation. If you get more inflammation, patient will become more sick. You want patient to feel better. Okay? So, do exosomes break the blood-brain barrier? Yes, exosomes can cross blood-brain barrier. That's why we can also give it in stroke patient. We can also give it in patients who have neurological problems. Okay, so this is some biogenesis. We will talk about each of these things during the course, how each of these will help. Now, when you're giving exosomes along with your NK cells, what happens? When you're giving exosomes along with your dendritic cells, what happens? Because in cancer, nowadays there's a lot of NK cell therapy, dendritic cell therapy, CAR T cell therapy. So when you're giving all these therapy along with exosomes, it will definitely boost the effect of these therapies, because these therapies are a little bit more expensive. And if the patient is not prepared properly, the therapies will not work. So when you give it along with exosome therapy, you get a very good result and the patient feels much better. At the end of the day, whatever we do as a doctor, we want our patient to feel better. Okay, so hair loss and all, people are doing exosome, skin therapy, people are doing exosome. Of course, I am practicing more exosome for autoimmune conditions, cancer condition, and more of inflammation, chronic inflammation conditions, patients with cirrhosis. So what we do with the patient with cirrhosis, sometimes we take the exosome and with the help of the ultrasound, we can inject it in that liver, and we are seeing the new growth of the liver. We have injected exosome in patients who have neurological conditions, and we have seen the neurological conditions get much better. Demyelination has come back. Demyelination has got slower. See, because your patient with MS, multiple sclerosis, is deteriorating day by day. What is the treatment? There is no treatment. They are giving some immunotherapy nowadays, or they are giving steroid, high dose steroid, methylprednisolone. How much a poor fellow can take methylprednisolone? Patients have come to me with multiple sclerosis. They just come with sudden blindness. Doctor, I can't see anything today. From yesterday it was normal. You look at the optic nerve head is white. You have to start them on immediately methylprednisolone IV. They get better for 2 days, they go home. After 3 months they come back. How much can you keep doing this thing? For them, I tell them once in a month or twice in a month, you start with this exosome therapy. So we precondition them for the nerve cells. So what do we give them? We give them bromelain, we give them nanocorcumin, we give them bacopa over a period of months, 1 month. Then every month you do the exosome therapy. So then his attacks start to come down. If he was landing up in the hospital every month, he'll land up in the hospital every 6 months. Then he'll land up in the hospital every 1 year, then every 2 years. and then gradually these diseases come down. Okay, so angiogenetic availability also helps. So we have done exosome. Actually, I have not done this. A friend of mine who's cardiologist, he has done this exosome along with the cardiac catheter. So he has injected at the ostium, and what he has found that the angiogenesis is much faster than in a normal way, because we know that in a cardiac condition, the stent doesn't save the patient, the bypass doesn't save the patient. If you have to die, you'll die immediately with a cardiac condition. It is the angiogenesis that is already taking place is saving the patient. So you want new blood vessels, and these new blood vessels grow faster with this exosome therapy. Okay, osteoarthritis, we have got very good results. So this is how it acts, how each of the receptors act. Now, you can tell me, you're saying, okay, I'm giving the patient, exosome is being produced in my own cells. Then why do I need to do the procedure? Right? I'm only producing the exosome. You yourself are eating the supplement, you yourself are producing the exosome. Why do you need this whole procedure? I'll tell you. Ideally, exosome is a normal way of your body healing itself. But why do you need this procedure? Because your body has to be under stress, and when you are treating a local condition. I'll tell you another way where we use exosome therapy to treat, but it was not called exosome therapy. This was more than 20-30 years ago. They're still doing hypothermia therapy, and they give B17 and all that in the hypothermic chamber. So why do you keep the person in for 6 hours, 8 hours, so long with the nutrition? Hypothermia always given with the nutrition, with the IV nutrition, because your body gets under so much stress that it starts to produce natural exosomes, natural CAR T cells and NK cells and all the dendritic cells, all these different types of cells, and that's how it kills the cancer cell. Now, it's not possible for me to take every person who comes and put them in a hypothermia chamber, because I don't have space. The clinic is small. We don't have a very big clinic. Secondly, cost. Cost factor of running an hypothermia is a lot of electricity, a lot of stuff. Thirdly, people don't have time. And fourthly, it is not practical. A person who has a knee pain, I throw him in a hypothermia chamber for 8 hours. It doesn't make sense. So what you do is that you create artificial hypothermia. You take out the blood after he has all this stuff. You take off the blood. You heat the blood to 38 degrees. 37 is body temperature, right? We want something higher. The blood is stressed, 38 degrees. You heat it for 38 degrees for 30 minutes. After it is being heated, then the exosomes are produced in that blood itself. What type of exosomes? Both the exosomes, inflammatory and anti-inflammatory. Now you want more amount of anti-inflammatory exosome, correct? That's why you have already preconditioned the patient before with the supplement. There the gut microbiome came into play. There I showed you the first two pictures of intracellular vesicles, extracellular vesicles came into play. Now what happens? Suppose you tell them, okay, just come and take your blood, I put it in the incubator. Yes, exosomes will be produced, but most of those exosomes will be pro-inflammatory. So if you have not preconditioned the patient and you take out that exosome and you produce and you inject it back into the patient, in fact you will cause more harm than good, because you are injecting only inflammatory substances. Of course, there will be some natural anti-inflammatory substances, but the inflammatory substances will be much higher. We want to quantify and produce more of anti-inflammatory substances. And how do you know that? We have done electron microscopy. I will show you all the slides of electron microscopy in the training. How after the precondition, the electron microscopy shows the exosomes. And without preconditioning, you see only inflammatory exosomes. Then we have something called zeta sizer that tells us the size of the exosome. You will see that the anti-inflammatory exosomes are much more as compared to the inflammatory exosomes in patients who have been preconditioned and not been preconditioned. Okay, so again in cancer therapy we can use of exosomes, tumor-derived exosomes, okay, in regulation of molecule. Now this is very important. In cancer, preconditioning is one of the most important things. Otherwise, exosome will not work. We have a protocol for every different disease and every different cancer. Only if you have that protocol, then you go for the exosome. The protocol consists of both the things, IV as well as oral. Like in the IV protocol, we can put 25 grams, 50 grams of vitamin C. Now in the vitamin C, we have to use sodium ascorbate. That's what we're discussing with Dr. Shri, that sodium ascorbate has more bioavailability as compared to ascorbic acid. In the oral protocol, we give certain things like nanocurcumin and bromelain, especially in solid tumors, because bromelain is a proteolytic agent. It needs to break down. So how it is going to break down? The bromelain itself is not going to break down. You eat the bromelain, the bacteria will eat it, that will give cell signaling. Those cell signals will tell other cells to actually break down the tumor. So, you know, every tumor, everything, we have a different protocol how to treat, what to do. Okay? So you see exosome biology is coming up. People are using plant exosomes, I don't know how. They're getting in the bottle. I have seen rose exosomes and all that for the face. I don't know how it is going to work. Maybe people. And it's not the quantity of exosome that matters, it's the quality of exosome. So you have one exosome. You know, one exosome can actually do the job. You don't need millions and billions. That's what I told you. It's you're having all your remotes and you're trying to press. But then something, doctor, but I get some results. I'll tell you how you get the result. Right? It's selling in the market. People are using it. Doctors are smart. Doctors are not fools. If you don't buy it, if you don't get a result, second time you won't buy it. Right? Your patient will complain. The worst thing for a doctor is not the money, is not making money. The worst thing for a doctor is when the patient says, doctor, I don't have result with your treatment. That hurts you the most than selling or giving money. I know that. Every doctor, and the best thing is not him earning some money. He's saying, doctor, I'm so happy now with your treatment, I can do something. All of us know this feeling. It is not about making money. Everybody can make money. Every doctor can make money. The fact that you're a doctor, you will definitely make money. But the most beautiful thing is that you tell them, when the patient comes to you, or the mother or father of the patient comes and says, doctor, with your treatment, my son, daughter has got new life. That's the best thing. So how does those things work? See, if you see immunology, there are certain receptors and there are certain proteins. The receptor has to fit the protein perfectly. That is a perfect fit. But sometimes there is an imperfect fit. With the imperfect fit, you may get some amount of relief. The immune system may start to some amount of relief. That is what happens when you use outside exosomes. It's not a perfect fit, it's not a perfect cell signal. Now, when you're using exosomes that come in bottle, if it is from animal source, you also have to check for microRNA. Because microRNA, just like a RNA vaccine, codes for protein or blocks the coding of a particular protein. So why would you want some microRNA which you've not even tested coming into your cell and coding for some foreign protein which you don't even know that exists? Because you can't test every microRNA in every bottle, right? It's not possible. But at least if something is coming from your own body, you know that has come from you and it is going back inside you. So there is no chance of miscoding or misinformation that comes into your DNA. Okay, so so what we do is that we can take this exosome, and from the blood we can prepare it and we can either re-inject it locally or you can inject it systemically. I have also injected exosome for, blockage of these vessels. It's called the word. Pardon? Yeah, DVT and vascular claudication. So in vascular claudication and DVT, what happens? You want the accessory vessels to start pumping. Right? So you inject exosome over there, and you will find it. Then you can do a CT angio, okay? Or you can also do ultrasound Doppler, and you can see the new blood vessel coming. It's not just just the patient feeling better. You can actually measure, because unless you can measure something, it is scientific. Otherwise, it's not scientific. I don't believe in information what we cannot measure. It should be measurable, quantifiable. I think the time is getting over. I'll just move past. So the new tool in regenerative medicine is exosome, which you can add to the arsenal, and you can start using. I'll show you some pictures of, these are cosmetic pictures where we have tried exosome on cosmetic cases, because it's difficult to show. I can show you, that will be during the training. I'll show you the reports before and after, how the patient has improved, but these are just cosmetic because there was not much time. So again, this is how we prepare the exosomes. Come in a kit like this. You draw the blood. This is the incubator that stresses it out. It's very simple. It stresses it out. Then you separate it by centrifuging, and then you filter it. There is a filter. So if you see, this is the filter. Now the pore size of this filter is proprietary, and the pore size of the gel is proprietary. So you can see when you filter this is the exosome with the plasma. So when you test this, go and test. If you find platelet, please throw it out. You cannot find platelet in this, because this is not platelet-rich plasma. When you go and you do your PRP, you test this, here you will find a lot of platelets, 5 times more, 10 times more than the normal platelets. So this is how to make sure. Somebody asked me how to make sure whether this is PRP or this is exosome. So this gives you one thing, that this is really exosome. Second test is put it under the microscope. In the microscope, you will see, which microscope? Electron microscope. In the electron microscope, you will see that the exosomes of 100 nanometers. Okay. So this is the staining. You can see the platelets. These are a PRP staining. And this is an exosome. So you can't see anything. You just see blue color. Okay. Somebody else asked me, how do you know this is exosome and this is not platelet? Now I am asking one more question. How do I know this is serum and this is not exosome? One more, I'll take it further. So when you test this under the electron microscope, you will see the exosome. And when you put it in a zeta sizer, you will see the particle count. There's something called a zeta sizer. You will see the particle count and the zeta potential. So the zeta potential is negative. Anything that you want to inject in your body and you want it to work, the zeta potential should be negative. So if it is negative, it is negative, and that is the exosome. So again, these are some scars that we inject. I'm only showing cosmetic examples. I'm not showing autoimmune and systemic cancer examples, because that we need more time. So again, this is healing of the 20 sessions. They wanted to amputate this foot, but we saved it. This. Okay. One more thing. When we are doing exosome or any therapy, I always say use the holistic therapy. Okay, I will do ozone, I will do oxygen, I will do exosome, I will do supplement, all in one. Because at the end of the day, I am not here to prove to the patient my exosomes work. I want the patient to get better. So whatever is your adjuvant therapy, you can join it. That will get the best result. Okay, that and exosome helps accelerate your best result. It amplifies your result. Okay, this I don't know if you can see clearly. This is vitiligo. So we injected. The vitiligo is totally gone. Okay, this is face. You can see. This is neck. This line. This is the after the breast lift. We have done some with the exosome again. Again, this is the face. Under eyes, we have seen. So in our center, patient comes from all over the world. Most of these are cancer patients who are coming for treatment. After they get well, they also want to do something cosmetic. You know, because in cancer, the treatment itself is very difficult. They lose their hair, skin becomes black. So after they come to us, they get all these treatments done. Then they say, doctor, I want to do something for my skin. Doctor, I want to do something for my hair. So that's how we get more of our cosmetic patients. We don't do cosmetic, but it's our cancer patients or autoimmune patients who are recovering and then they want to feel good. So when they do it, okay, we help them, so then they start exercising. It's a boost. When a person looks good, he feels good, he wants to, go ahead. Again, this is a full face. This patient, he had, you can see, he's got nice hair now. He had alopecia totalis. He had two things. He had cancer also and he had alopecia totalis. And now he can see. So this is just another hairline we did. This is stretch marks, 10 sessions. And this is we are also using for some patients who want, ED problem, penis enhancement and all this. We are doing it. This is for the vaginal tightening. So along with laser, we are doing exosomes. So we are getting some lasers nowadays, ablative lasers, RF frequencies. We have gynecologists visiting our center. So the gynecologist will inject. We will prepare the exosome and give it, the gynecologist injects. Thank you so much, and I hope to see you again next year. Thank you. Thank you, Doctor.
Thank you very much, Dr. Leroy, for your very interesting topic today. And we also certainly hope to see you again next year.
Thank you.
Thank you very much. Thank you, everybody, for your attention.